Hey guys, so today we're going to be talking all about Meniere's disease. So by the end of today's lesson, you will understand what Meniere's disease is, how it's caused, the different assessment findings that you'll see, therapeutic management, and nursing considerations when you're caring for a patient with this disease process. Okay, so I wanted to start with just a brief overview of what Meniere's disease is. So guys, basically Meniere's disease is a disorder of the inner ear. And this is caused by excess fluid buildup that distorts the inner canal system in the inner ear, which causes different symptoms such as vertigo, tinnitus, and sensorineural hearing loss. Oops, sorry about that. So just to review, it's a disorder of the inner ear. It's caused by excess fluid buildup. And then these are the symptoms that these patients will present as. They'll have vertigo, tinnitus, and sensorineural hearing loss. Okay, guys, so let's go ahead and just kick things off with a little patho. So with Meniere's disease, there's an excess of endolymphatic fluid that distorts the entire inner canal system. So here, this is a picture of the ear. And this picture right here, this is just kind of a closer up image of the inner ear structures. So let's go ahead and just add some extra fluid here. And this is where we would see this extra fluid buildup. So once that extra fluid builds up in the system, it throws off the entire system. So this disease decreases the hearing by dilating the cochlear duct. So it dilates the cochlear duct. So with all that extra fluid, it doesn't have anywhere to go. So the cochlear duct has to dilate and it gets bigger. Okay, so it also causes vertigo due to damage of the vestibular system due to increased pressure from all the excess fluid. So again, the fluid has to go somewhere. It doesn't have, anywhere else it can go. So it causes the vertigo by damaging the vestibular system due to increased pressure. Then it also stimulates tinnitus, which is the perception of noise or ringing in the ear. Okay, guys, so looking at assessment findings. So the key characteristics with a patient with Meniere's disease includes tinnitus, one-sided sensorineural hearing loss, and vertigo. So these attacks can be pretty severe. They can also present with nausea and vomiting as well. So sometimes patients will experience an aura, kind of like people do with migraines. So they may have an aura prior to the attack. So they could have headaches or fullness in the affected ear prior to attack, kind of letting them know, hey, you're gonna have an attack that's upcoming. But this isn't all patients. It's just some may have an aura. So in early stages, the patient's hearing is normal or nearly normal between episodes or attacks. So really the disease just affects them when they do have the episodes. Otherwise, hearing is normal or nearly normal. And then permanent hearing loss develops over time as the attacks increase due to damage to the cochlea from the increased fluid pressure. So every attack that they have, it increases the damage. So over time, permanent hearing loss develops just because the attacks just continue to happen. Okay, guys, so treatment starts with non-surgical management. Just like a lot of other disease processes, we want to start as least invasive as possible. So with non-surgical management, a patient could try the high drops diet. So this diet helps stabilize the body fluid levels to prevent excess endolymph accumulation. So considerations with this diet include even food intake levels through the day, avoiding foods high in salt, ensuring adequate fluid intake while minimizing caffeine intake. So again, those include even food intake levels through the day, avoiding high salty foods, ensuring adequate fluid intake, and then minimizing caffeine intake as well. So patients should also minimize alcohol and avoid foods with MSG in them as well with this diet. The medications that will be given, they are aimed at reducing vertigo and vomiting and helping the patient restore normal balance. Okay, so one of the medication therapies is the use of mild diuretics. So this helps decrease the endolymph volume. So if you'll remember back to kind of the patho, it's increased fluid that's in the endolymph, it's the endolymphatic fluid that's increased. So the diuretics, they help decrease the endolymph volume by helping the body secrete that extra fluid. So this directly reduces vertigo, hearing loss, and tinnitus. So medications like Dramamine, Benadryl, and Antivert can help reduce the severity or help actually stop the attack altogether. So different medications such as Zofran and Phenergan, they can be given to help reduce the nausea and vomiting. And then Valium can actually be given to help calm the patient and reduce vertigo, nausea, and vomiting as well. And this helps the patient kind of rest and relax during the attack. So going on to surgical management, this is once, all the non-surgical treatments have failed. We need to kind of look into other options. So this is kind of a last-ditch effort, and it's only used if the conservative treatment fails, as it can cause further hearing loss. So one of the procedures that can be performed is a resection of the vestibular nerve or labyrinthectomy. So these are both the most radical procedures that are done. So another procedure that can be performed early in the course of the disease is endolymphatic decompression with drainage and shunt placement. So the effectiveness varies with this procedure, but basically the endolymphatic sac is drained, and that helps the fluid just kind of get drained off. Okay, so patient education, it's pretty straightforward with his disease process. So first, we want to be teaching about different things to help prevent the vertigo and to help manage that. So we want to teach patients to move their head slowly, avoid super sudden movements, anything that could cause them to do like a jarring motion with their head that could worsen their vertigo. Then we also want to be teaching about the high drops diet if indicated. Okay, guys, so one of the nursing concepts with Meniere's disease is an alteration in sensory perception. Okay, so since the patient has difficulty with hearing and tinnitus, their sensory perception is going to be altered. The other nursing concept is an alteration in functional ability. So since our senses comprise so much of our day-to-day life, a decrease in hearing ability can greatly impact a person's functional ability. Okay, guys, let's go ahead and just do a quick recap of the key points from today's lesson. So first, I want you to remember the assessment findings. So these are going to manifest as tinnitus, sensorineural hearing loss, and vertigo. The treatment options are going to start with non-surgical treatment first, so such as a high drops diet and medication management. If non-surgical management fails, then surgical management may be considered. Again, this is kind of a last resort as it can cause further hearing loss in the patient. And then finally, we want to be teaching the patient about doing things to help prevent the vertigo from getting worse. So like moving their heads slowly and doing, not sudden movements, and educating about the high drops diet as well if that is indicated with this patient. Okay, guys, so that is it for a lesson on Meniere's disease. Make sure to check out all the other resources attached to this lesson. Now go out and be your best self today. And as always, happy nursing.